preferred method is using an alcohol-based solution and used in conjunction with the following steps. Performing hand hygiene, make sure all skin surfaces are accessible and free of cuffs. Nails should be short and clean. Hand wash will remove transient microorganisms only, where alcohol-based hand wash will destroy transient microorganisms as well as resident microorganisms.
Check the ear canal for clear view of tympanic membrane, which includes removing any hearing aids. Take the thermometer from charging unit and slide a clean disposable speculum cover over the lens tip. For an accurate reading, you must pull back the pinner of the ear backwards, up and out. Fit the thermometer comfortably and snugly into the canal. Point towards the nose and do not move. The probe is in place. Press the scan button on the handheld unit and wait a few seconds to hear the audible signal that tells you a reading has been established. Once reading has been recorded, carefully take out the speculum from the auditory meatus. Down the ejection button to discard of the plastic probe cover, reducing transmission of microorganisms. Explain the procedure of taking the pulse to the patient and encourage relaxation. Use the pads of 2 fingers to assess the pulse. In this case, it will be the radial pulse. So place fingers over the radial groove of patient's wrist. If the patient has a irregular heartbeat, count for 30 seconds and double it. Or if the patient has an irregularity in their pulse, count for 60 seconds to determine a more accurate result. Also note the strength of the pulse: bounding, normal, weak, 3D, or absent. Determine previous baseline respiratory rate from the patient's records if available. Make sure the patient is in a comfortable position, preferably sitting or lying with the head of the bed elevated. Place patient's arm in a comfortable position across the abdomen or lower chest, or place nurse's hand directly over patient's abdomen. Observe complete respiratory cycle, which is 1 inspiration and 1 expiration. After first cycle is observed, begin to count the rate, counting 1 with first full respiratory cycle. If rhythm is regular, count for 30 seconds and multiply by 2. However, if irregular, less than 12 or greater than 20, count for a full minute. Observe chest wall movement whilst taking respirations.
Select the appropriate cuff size for the patient. This will ensure a more accurate result. Correctly position the patient either seated or lying down. Select the appropriate limb which is relevant to their existing condition. Place the centre of the bladder over the brachial artery. Centre arrow on cuff above artery. To determine the baseline blood pressure, palpate the radial artery. Inflate the cuff until the radial pulse. Record this reading as the baseline. Using the stethoscope, locate and palpate the brachial artery. Close valve of pressure bulb clockwise until tight. Inflate cuff 20 to 30 millimeters of mercury above the baseline. Slowly release pressure bulb and arrow gauge to fall slowly. Listen for the first clear sound and record this as your systolic pressure. Continue deflating the cuff, noting the point where the sound disappears. Record this as your diastolic pressure.